Thank you, Lynn. And thank you so much for having us be a part of this conversation this morning. It's exciting. So Altarum spent a good portion of last year working on an environmental scan of Berrien, Cass, and Van Buren counties to really get a better understanding of what is occurring in these communities on a number of different levels. What we'll present to you this morning is just a portion of that data analysis that was conducted. And by the end of our time together this morning, we hope you will see a very clear need for an immediate and structural link to home and community-based services for people in these counties. Next slide, please. We wanted to start off by understanding the age of the population in these counties. And we found that in all three, they're aging. We looked at 4 age categories in each county to understand where any growth or decline is coming from over the next 10 years. Projections suggest that the number of people under 20 in Berrien County will remain relatively stable. There's projected to be an increase in the 20 to 44 age group, a decline in the 45 to 64 age group, and an increase in the over 65 population. Next slide, please. And this story is pretty much the same in Cass County. We see that increasing over 65 population. Next slide. As well as Van Buren County with that increasing of over 65 population. So we really became interested in that over 65 population and what that looks like in terms of projection over the next 10 years. Next slide, please. And again, all 3 counties very much reflect a similar story. We found that the 70 to 79 age group and the 80 plus age group are projected to increase over the next 10 years in Berrien County. Next slide, please. Cass County. Next slide, please. And Van Buren County. Next slide, please. And what we know about the older populations growing in these counties is that they likely will have higher healthcare needs. So what kind of healthcare needs should we be expecting? We had access to a uniquely analyzed Medicare claims data set from 2018. And we were able to isolate Berrien, Cass, and Van Buren counties and understand what types of conditions were showing up on the Medicare claims and how often patients were identified as a major complex or minor complex patient. Next slide, please. And this chart just shows us a breakdown by county of these conditions that came out in the claims data in 2018. Next slide, please. But another unique piece of an analysis we did from our third-party Medicare claims data was the way they determined potentially avoidable emergency department visits. And this helped us really understand how often this may be occurring in these communities. Next slide, please. So in 2018, for Medicare patients in Berrien, Cass, and Van Buren counties, there were 9,620 claims with an emergency department visit coded on them. Then using algorithms developed by NYU Billings, they identified a number of those claims that were absolutely needed and not avoidable. But they were also able to identify visits to the emergency department that were for conditions that could have really been treated by a primary care physician. They identified visits to the emergency department that at the time were emergent, but could have been avoided if the treatment had been sought earlier. And finally, they identified visits to the emergency department that were not really emergency conditions. So I want to make really clear here that claims data can be messy and really complicated to work with. It's just numbers. There are no clinical nuance. There's no clinical nuance there to help determine whether something really is an emergency or isn't. Using algorithms to trigger or flag certain events can tell us whether or not something was an emergency, and in the absence of those flags, that likely it was not. When you only have claims data available to look at, algorithms like that are really the best way to get at some of these types of questions. But we shouldn't take it definitively. We don't want to conclude that nearly 3,000 Medicare patients went to the emergency department in 2018 and shouldn't have. That's not what we're saying. What we want to do is use this as an indication that there may be a gap in the resources available in the community to make sure that the emergency department is being used as it's intended. Algorithms they can let some instances through and they can filter some instances out that should or should not be there. And you can see from this slide that nearly 5,000 of the total claims didn't even have enough information on them to be able to be categorized at all. So we also look at this as the floor. It's not definitive, but it's also not the max of what could be happening. It's an indication, a beacon, a bellwether. It's a signal that something might be happening here. Next slide, please. Again, this is a breakout by county. And we wouldn't say these are definitively avoidable and that they never should have happened, but we do want to look at that as that indicator of the resources available in the community to help these patients avoid the emergency department when they can. Next slide, please. I'm now going to hand you off to my colleague, Morgan, who will talk more about what we found in our environmental scan on community resources.
Thank you, Beth. So we've shown you data so far that tells us that the population in each of these 3 counties is growing older over the next 10 years, especially that 70 and over group. We know that this group often has multiple complex conditions and needs more healthcare services on average. So when they come out of the hospital, we need to know what is available for them. Next slide, please. So trends have shown that there's an increase in discharging patients home and that discharging to a skilled nursing facility has remained relatively stable. So though this doesn't include 2020 numbers, this is a trend that we should be aware of. Next slide, please. So if more and more patients are going home, what kind of long-term supports and services are needed? So we developed a proxy number of need by establishing the number of patients who scored at 3 or higher on the Charlson Comorbidity Index, which takes into account comorbid conditions and other factors that influence an individual's burden of disease. And as you can see from these 2018 Medicare claims, there's a pretty substantial need in each of the 3 counties. Next slide, please. And then we looked at the availability of resources for long-term supports and services in each county, and we can see that there's a shortfall of resources available in each county, especially for those home and community-based programs. Next slide, please. So overall, our analysis showed that there's an aging population in each of the 3 counties, specifically that 70 and older population. We know that this group tends to need more healthcare services in general, and the indication of how often the emergency department was used when it could have been potentially avoidable will likely increase as the age of the population increases if there is no intervention put in place. Our data also shows that more and more patients are being discharged home, and there's an immediate and structural link. There's a need for immediate and structural link to home and community-based services in each of those 3 counties. Next slide, please. With that, I'd like to thank you. Each of our emails is here if you have additional questions, but I think we have some time to take a few questions now.
Thank you, Sarah. So we had a question on what did the change in the emergency department use look like with COVID-19? That's a really great question. I think as Dr. Hamill alluded to in the opening video, there's evidence that shows that care went down and that people in this age group went without care during COVID, and even now as we were working through those processes. What the data is going to tell us, we have yet to see. So I think it'll be really important for us to follow that and follow up with that, just to really understand what was happening. We know there was a drop off, right? We only need to look to the financials to understand that there was a drop off in healthcare services during this time. What we don't understand is the impact of that. What we don't understand is what was happening with those patients. What we don't understand is where they were going quite yet. We will because that has our attention, and we will focus on that. But right now, we're just guessing at what happened really starting a year ago now.
Thank you for that question, Sarah. So the question is, how has COVID-19 impacted home and community-based services? So in general, there was a downward trend in SNF occupancy rates nationally in 2020. Hospitals and home health agencies experienced a similar drop, but began to recover in spring of 2020. SNFs didn't really see that same recovery and continued to have low occupancy rates. Many hospitals were doing all that they could to not discharge people to SNFs and instead discharge them home. So this will likely accelerate the need for home and community-based services. But as Beth was talking about with the emergency department use, we will have to see how this goes.
So the question is there a complete report of your analysis, and will that be available to attendees? Yes, there is a complete report of our entire analyses. And I will let Peggy and Lynn and the team decide how they would like to disseminate that to the attendees.
Beth, do you want to take the next question?
Sure. Is that who in the community has access to the data collected besides healthcare? When we have put together our final report, the access to that information will be shared. And I'm seeing that the report is on the Area Agency on Aging website.
I see another question. The community-based organizations mostly experienced huge increases, perhaps looking at that data. That's definitely data that we should track over time, especially with the increased need for home and community-based services. And I am sure that our group will be we'll be following that closely.
Well, if there's no other questions, it's now our pleasure to welcome Melinda Gruber from Spectrum Health Lakeland. Thank you.